This video is to help you determine if the way you move puts you at risk for injury or overuse in your legs. We'll demonstrate correct and incorrect techniques for 2-leg squats, 1-leg squats, and 1-leg balance. You can do your self-assessment in the mirror. If your technique is incorrect, we will provide exercises that can help you strengthen and promote better form. On the squat, we look for a level pelvis, neutral spine, and knees pointed towards your second toe and kept behind your toes. With incorrect form, the knees tend to point inward or wobble, which causes stress on the knees and the surrounding tissue. Here you can see good balance over the feet with knees pointed at the second toe. From the side, you see good bending at the hips with neutral spine, not flexing too much or extending too much, and knees not extending past the toes. With incorrect form, the trunk is more upright and the knee moves out past the toes. With one-legged balance, we look for a level pelvis and an upright trunk. Common errors include leaning your trunk to either side or having your pelvis drop down. Again, try to keep that trunk upright and that pelvis level. One-legged squat is challenging to most. You can have your opposite leg in front as shown or behind with the knee bent. Look for a level pelvis, upright trunk, knee pointed towards the second toe, and good balance. With the incorrect position, the knee tends to angle inward or wobble. The hip may move out to the side, or the opposite pelvis drops. Now that you've assessed your mechanics, here are some exercises that can help you make corrections. Using a chair, a sitting back squat is useful to remind you of your position. Correct position in neutral spine with proper bending at the hips and knees, leading just over your second toes. Common errors include knees rotating inwards, extending knees past your toes, and either arching or rounding your back. Second exercise, the clamshell, helps you to strengthen your hip rotators. Lay on your side with your hips perpendicular to the ground and your knees bent. Keep your heels together and open and close your top leg. Remember to keep your pelvis upright and don't roll back, as seen in this incorrect version. Bridging helps you to strengthen your core and hips. Tighten your abdominal muscles and lift from the hips up to neutral or straight. Common error includes arching your back too much. You should really feel this in your buttocks and not in your low back. Quad stretching will help you maintain flexibility in your quad muscle. Bring your heel towards your bottom, keeping your knee pointed down and your spine in neutral, or your buttocks tucked under. If you do not feel a stretch in this position, pivot back at the hip while maintaining a neutral or straight spine. Common errors with this stretch include arching your spine or bringing the leg out sideways. Thanks again for watching Tips for Healthy Knees. If you have questions or concerns, check with your primary care provider who may refer you to physical therapy.